Are your fingernails turning blue? Do you find yourself suddenly confused or unusually tired? These could be deadly warning signs your body isn't getting enough oxygen, especially if you're over 70. In the next few minutes, I'll reveal the 8 deadly symptoms of low blood oxygen that seniors must recognize, plus exactly what to do if you spot them, potentially saving your life or the life of someone you love. The 5th symptom is so commonly mistaken for normal aging that 83% of seniors miss it completely, with devastating consequences. Margaret, 72, thought her sudden confusion and blue-tinged fingernails were just part of getting older. By the time her daughter noticed and rushed her to the ER, her blood oxygen was dangerously low at 78%. The doctor said she was hours away from potential organ damage or worse. Thankfully, Margaret received oxygen therapy immediately, but many seniors aren't so fortunate when these critical warning signs go unnoticed. Symptom 1. Bluish discoloration of fingernails and skin. If your fingernails, lips, or skin develop a bluish tint, you could be facing a life-threatening oxygen emergency that requires immediate medical attention. According to the Mayo Clinic, this bluish color called cyanosis appears when your blood isn't carrying enough oxygen to your tissues. This happens because deoxygenated blood appears darker and gives your skin and nails a blue or purple hue. When oxygen levels drop below 90%, this discoloration becomes visible, especially in areas with thinner skin like fingertips, lips, and around the eyes. James noticed his fingernails looked slightly blue after his morning walk, but dismissed it as poor circulation from the cold weather. 3 hours later, he collapsed in his kitchen and required emergency oxygen therapy after his neighbor found him. Without prompt medical attention, this oxygen starvation can rapidly damage your heart, brain, and other vital organs within hours. The body can only compensate for reduced oxygen levels for a limited time before cells begin to die from oxygen deprivation. Do a quick fingernail check daily. Press firmly on your nail and watch for normal pink color to return immediately when you release the pressure. If it stays blue or returns very slowly, seek emergency care without delay. This simple test, called the capillary refill test, can reveal dangerous circulation problems in less than 3 seconds. For those with darker skin tones, check inside the lips, gums, or the lining of the eyelids, as these areas will show bluish discoloration more clearly than fingernails. Don't wait even a day to see if it improves. Oxygen deprivation can cause permanent damage in just hours. Symptom 2. Sudden confusion or memory problems. Have you experienced sudden confusion, memory loss, or difficulty concentrating that wasn't there yesterday? This rapid change could be your brain signaling that it's not receiving enough oxygen to function properly. Harvard Medical School research shows that seniors with low oxygen levels often develop sudden confusion that can mimic dementia, but it's actually a medical emergency that requires immediate intervention. Your brain consumes approximately 20% of your body's oxygen supply, despite making up only 2% of your body weight, making it extremely sensitive to oxygen deprivation. Barbara's family thought her sudden confusion was early dementia when she couldn't remember how to use her coffee maker and became disoriented in her own living room. Fortunately, her doctor discovered her blood oxygen was only 85% due to an undetected lung infection. After appropriate treatment, her confusion completely resolved within days. Low oxygen to the brain can cause permanent cognitive damage if not treated quickly, leading to actual dementia-like conditions that could have been completely prevented with prompt medical care. If you or a loved one experiences sudden mental changes, check for other symptoms on this list and seek medical attention immediately. Keep a daily journal noting any unusual mental lapses or confusion so you can recognize patterns and sudden changes. The most telling sign is when confusion develops over hours or days rather than months, which distinguishes it from true dementia. Having a baseline of your normal cognitive function makes it easier to identify concerning changes. Never assume sudden confusion is normal aging. It could be your brain desperately signaling for oxygen. Symptom 3. Shortness of breath or difficulty breathing. Are you finding it harder to catch your breath during normal activities like walking to the mailbox or climbing a flight of stairs? This progressive breathlessness deserves immediate attention, especially when it develops or worsens over a short period. Johns Hopkins pulmonologists warn that increasing breathlessness in seniors is often the first sign of dangerous oxygen deficiency, not simply aging or being out of shape. Your respiratory rate naturally increases as your body attempts to compensate for lower oxygen levels, but this mechanism can only help temporarily before more serious symptoms develop. William blamed his shortness of breath on just getting older for weeks, adjusting his activities to avoid exertion rather than seeking help. By the time his daughter convinced him to see a doctor, his severe hypoxemia had already begun to strain his heart, leading to a hospital stay that could have been prevented with earlier intervention. Ignoring this symptom forces your heart to work harder to distribute limited oxygen throughout your body, potentially leading to heart failure or permanent lung damage that becomes increasingly difficult to treat. Time. How long you can speak in complete sentences without gasping for breath. If you can't finish a full sentence, your oxygen may be dangerously low and requires immediate medical evaluation. Another simple test is counting how many steps you can take before needing to pause for breath, and tracking this number over time. Any sudden decrease in this capacity warrants a call to your doctor. Using a pulse oximeter at home can provide objective measurements of your oxygen levels, with readings below 92% indicating a need for medical attention. Don't dismiss breathlessness as normal aging. Call your doctor today before this reversible condition becomes permanent. Symptom 4. Rapid heart rate, tachycardia. Is your heart racing or pounding even when you're resting or doing light activities like folding laundry or preparing a simple meal? This unexplained increase in heart rate should never be ignored, especially when it persists or recurs frequently. The American Heart Association confirms that when blood oxygen drops, your heart races to deliver more oxygen to vital organs. A clear warning sign that your body is actively compensating for reduced oxygen levels. A consistently elevated heart rate above 100 beats per minute at rest, tachycardia in seniors, is always abnormal and requires prompt medical evaluation. Susan's persistent heart rate of 110 at rest was her body's desperate attempt to compensate for oxygen levels that had dropped to 86% due to undiagnosed pneumonia. She mistakenly attributed her racing heart to anxiety until her doctor connected this symptom to her slightly blue fingertips and fatigue. This emergency response mechanism puts tremendous strain on your heart, potentially leading to heart failure or cardiac events if the underlying oxygen deficiency isn't addressed. Your heart can only maintain this compensatory response for so long before the strain becomes dangerous. Check your pulse regularly by placing 2 fingers on your wrist or neck and counting the beats for 30 seconds, then multiplying by 2. A resting rate consistently above 100 beats per minute requires immediate medical evaluation, especially when accompanied by any other symptoms on this list. Several smartphone apps can now accurately measure heart rate using your phone's camera, providing a simple way to monitor this vital sign daily. Your racing heart is sending you an urgent message. Don't ignore this critical warning system that could be alerting you to a life-threatening condition. Symptom 5. Unusual fatigue or weakness. Have you noticed overwhelming fatigue that doesn't improve with rest? making even simple tasks like showering or preparing meals feel exhausting. This debilitating tiredness is often dismissed as inevitable aging, but it could be signaling a dangerous oxygen deficiency. According to research from the Cleveland Clinic, unexplained fatigue in seniors is often the body's response to insufficient oxygen reaching muscles and tissues. When cells don't receive adequate oxygen, they can't produce energy efficiently, leading to profound weakness that significantly impacts your quality of life and independence. Robert thought his extreme tiredness was just part of growing older until his doctor discovered his oxygen saturation was only 87% due to undiagnosed COPD. After starting appropriate treatment, his energy levels improved dramatically within weeks, allowing him to resume his daily walks and gardening hobbies. This isn't normal aging. Chronic oxygen deprivation gradually damages your organs and nervous system, potentially leading to permanent disability if left untreated. The fatigue from hypoxemia often feels different from normal tiredness. It tends to be present even after waking from sleep and doesn't improve significantly with rest. If walking across a room leaves you unusually exhausted, ask your doctor for a simple pulse oximeter test to check your blood oxygen levels. This non-invasive test takes just seconds and can identify dangerous oxygen deficiencies before they cause permanent damage. Keep a daily energy journal, rating your fatigue on a scale of 1 to 10 and noting any activities that seem unusually exhausting compared to your normal baseline. Don't accept debilitating fatigue as just getting older. It could be a treatable oxygen problem that's stealing your independence, but could be resolved with proper medical care. Symptom 6. Morning headaches. Do you frequently wake up with headaches that improve after you've been up and moving around for an hour or two? This specific pattern of morning head pain could be signaling dangerous nighttime drops in your oxygen levels. Mayo Clinic researchers have established that morning headaches in seniors often indicate nighttime oxygen drops, especially in those with sleep apnea or other breathing disorders that worsen during sleep. These headaches occur because low oxygen levels during sleep cause blood vessels in the brain to dilate, creating pressure and pain that's typically most severe upon waking. Carol dismissed her daily morning headaches for months, taking over-the-counter pain relievers rather than mentioning them to her doctor. When she finally discussed this symptom during her annual checkup, a sleep study revealed her oxygen levels plummeted to dangerous levels multiple times each night due to undiagnosed sleep apnea. These nightly oxygen drops not only cause pain, but can lead to high blood pressure, increased stroke risk, and accelerated cognitive decline if left untreated. The brain is particularly vulnerable to oxygen fluctuations during sleep when conscious breathing control is reduced. Track your morning headaches for 1 week. If they occur more than twice, request a simple overnight oxygen monitoring test from your doctor. This home-based test is non-invasive and can identify dangerous oxygen drops while you sleep. Elevating the head of your bed by 4 to 6 inches may temporarily help reduce these headaches while you seek medical evaluation, as this position can improve breathing mechanics during sleep. Don't suffer through another morning with preventable headache pain. This symptom demands attention now before it leads to more serious consequences. Symptom 7. Difficulty concentrating or reduced alertness. Are you having trouble focusing on conversations, television shows, or books when you never did before? Do you find yourself drifting off mentally during activities that once held your full attention? Johns Hopkins neurologists confirm that the brain is extremely sensitive to oxygen levels, with even slight reductions causing noticeable cognitive changes before other symptoms appear. Your brain requires a constant, rich supply of oxygen to function properly, and even small deficiencies can impair attention, concentration, and processing speed long before they cause physical symptoms. Thomas's family noticed he couldn't follow his favorite TV shows anymore and would lose track of conversations mid-sentence. Rather than assuming it was age-related decline, his doctor ordered an oxygen test that revealed his blood saturation was only 89% due to previously undiagnosed heart failure. Persistent low oxygen can permanently damage brain cells, accelerating cognitive decline and potentially leading to vascular dementia that could have been prevented with earlier intervention. The brain's frontal lobes, responsible for concentration and executive function, are particularly vulnerable to oxygen deprivation. Try reading aloud from a newspaper or book for 5 minutes if you find yourself losing track, struggling to pronounce words, or unable to concentrate on the meaning. Ask your doctor about testing your oxygen levels. This simple self-assessment can reveal subtle cognitive changes that might otherwise go unnoticed. Another effective test is attempting to subtract 7 repeatedly from 100, 93, 86, etc. Difficulty with this task could indicate cognitive effects from low oxygen. Your brain needs proper oxygen to function. Address this symptom immediately to protect your cognitive health and independence. Symptom 8. Changes in skin color, beyond blue, pale, or red appearance. Has your skin become unusually pale, gray, or excessively red, especially during minimal physical activity? These color changes are often overlooked, but provide visible evidence of your body's struggle with oxygen levels. According to research from the CDC, skin color changes in elderly patients often signal the body's attempt to compensate for low oxygen levels. Paleness occurs when blood is redirected away from the skin to supply vital organs, while excessive redness, especially during minimal exertion, indicates your body's desperate attempt to increase blood flow and oxygen delivery. Nancy's family noticed her face would become extremely red and her breathing labored during minimal activities like walking to the bathroom. Rather than dismissing this as poor conditioning, her doctor ordered tests that revealed her body was desperately trying to increase oxygen flow due to severe anemia and early heart failure. These color changes indicate your body's emergency adaptation mechanisms are already activated, putting dangerous strain on your heart and lungs that can lead to serious complications if not addressed promptly. By the time these visible changes appear, your body has likely been compensating for reduced oxygen for some time. Ask a family member to monitor your skin color during daily activities like climbing stairs or walking short distances. Unusual changes warrant immediate medical evaluation. Taking photos of your face, hands, and arms during rest and after light activity can help document these changes to share with your doctor. Unusual paleness or excessive redness that doesn't match your level of exertion should never be ignored. Your skin is literally signaling for help. Respond to this visible warning sign before it's too late to prevent serious complications. We've covered the 8 deadly symptoms of low blood oxygen that seniors must recognize. Bluish fingernails, sudden confusion, shortness of breath, rapid heart rate, unusual fatigue, morning headaches, difficulty concentrating, and skin color changes. Remember Margaret from earlier? After receiving proper oxygen therapy and treatment for her undiagnosed pneumonia, she's now back to her active, independent life with normal oxygen levels. Early detection saved her life, and it could save yours too. Most oxygen problems in seniors are highly treatable when caught early, but can be fatal if ignored. Don't dismiss these symptoms as just aging. They're your body's urgent calls for help. Have you or someone you know experienced any of these symptoms? Share your story in the comments to help others recognize these warning signs before it's too late. If this information could help save your life or someone you care about, please hit the like button and subscribe to our channel for more critical health information for seniors. And please share this video with every senior you know. that one share could literally save someone's life by helping them recognize these crucial warning signs before permanent damage occurs.